Hello and welcome to Medicare Savings Programs 101. I'm Emily Jenkins and I'm presenting today with Jane Beasley, one of our senior client advocates. And I'm going to start sharing our slideshow. If you have questions during the presentation, please put them in the Q&A so that we can see them. There's Jane and I, if you want to see what lovely Jane looks like. So I'm going to tell you a little bit about the Tennessee Justice Center before we get started. If you're unfamiliar with the work of TJC, we are a nonprofit public interest law firm. We provide direct services to individuals who are having difficulty accessing our state safety net programs. This direct service work informs our impact work to advocate for change through class action litigation or legislative or administrative changes. One example of our impact work is advocating for paid family caregivers. We're working in partnership with the Tennessee Disability Coalition and Family Voices to help families get financial relief for the care they may provide to their loved ones who are older or who have disabilities. If you're interested, we can connect you with our Health Policy Director, Vanessa Zapata. You can reach her through our website. Another example of our impact work is in the advocacy space for Elderly Simplified Application Project, also known as ESAP, for the SNAP program, which SNAP you may know as food stamps. Seniors who are food insecure in our state because of many barriers to the program, and we provide direct services in SNAP for older adults, but we also advocate for our state to opt into ESAP to make it easier for older adults and adults with disabilities to access SNAP. If you're interested, we can connect you with our nutrition director, Signe Anderson. Now, our work here at TJC includes the impact work, which is class action litigation to correct systemic issues. We advocate for legislative and administrative changes on a state and federal level. We have, again, our paid family caregivers campaign, our ESAP campaign. We do casework for individual clients, and we do litigation as well. Our agenda today is going to start with an overview, and then we're going to look at the program types, the application process, COVID impacts, and a Q&A session. To get started, I wanted to explain a little bit about basic terminology, because I know when I started doing this work, Medicare and Medicaid, I always got confused. And then you add in TennCare as a third term, and it's very easy to lose your plot when you're talking about these terms. Medicare is the federal health insurance program for people age 65 and older, and some people with disabilities and conditions. The cost of Medicare Part A is based on eligibility for Social Security or supplemental security insurance, and most enrollees in Part A receive it at no cost. Medicaid is the public insurance program that provides health coverage to low-income families and some individuals, including children, parents, pregnant women, seniors, and some people with disabilities. It is jointly funded by the federal government and the states. TennCare is the term for what you can think of as Tennessee's brand of Medicaid. You'll hear the terms TennCare and Medicaid used interchangeably, but in Tennessee, if you have Medicaid, it is TennCare and vice versa. For today's purposes, I'm going to be referring to it as TennCare. Now, we're going to be talking today primarily about MSPs. An MSP is a program that helps people with limited income and savings pay for Medicare costs. It's administered by the states, which for Tennessee means administered by TennCare. And depending on the type of MSP you have, it may cover Medicare Part A and Part B premiums, as well as deductibles and copayments. Some folks get their Medicare costs paid for automatically based on their TennCare category, and these people are in the Medicare Part B buy-in. There are general requirements for eligibility. The technical requirements are that you be a Tennessee resident, a U.S. citizen, U.S. national, or eligible non-citizen. The eligible non-citizen category is one that can be confusing for a lot of people. We do have trainings that specify the categories of eligible non-citizen that are eligible for TennCare and MSPs. You need to have a social security number. And then there's financial requirements. Financial eligibility has income and resource limits. Income limits are tied to annual updates in the federal poverty level, which typically are implemented in April. Resource limits are what you can own. For Medicare eligibility, you're entitled to Medicare Part A, and if you don't have Medicare, you have to apply through SSA, the Social Security Administration, first. When we look at the types of Medicare, there is Medicare Part A, that's your hospital insurance. It covers inpatient stays, care in a skilled facility, hospice care, and some health care. Medicare Part B is your medical insurance. It covers outpatient care, certain doctor services, medical supplies, and preventative services. For Medicare Part D, it's going to cover your prescription drugs, and it helps to cover the cost of prescription drugs. Now, throughout this presentation, we're going to be referencing income limits for the categories of eligibility. These income limits are current as of today, February 15th, 2024. But anytime you're looking at income limits, you may want to go refer to the TennCare eligibility chart, which is listed on this slide. And I also want to mention you will get a copy of all of these slides after the presentation. So it will give you the hyperlinks that are contained within the slides, and you'll be able to go back and reference all of the materials. TennCare's eligibility chart does not reflect some of the adjustments to income that are considered when you look at eligibility limits. It doesn't reflect income disregards. There's a $20 unearned income disregard. So for simplicity's sake, if you made $100 after the income disregard, you would be considered to make $80. There's also a $65 earned income disregard, which again, taking our hypothetical $100 earner would mean you would take $85 off and have an effective income of $15. When you look at the costs of original Medicare, this is the Part A, that's your hospital insurance. If you qualify for premium-free Part A, then your cost is $0. If you don't qualify for premium-free Part A, then it depends on your Medicare taxes. It can be up to $505 per month for your portion of the cost in 2024. Your inpatient deductibles are $1,632 for each benefit period in 2024. Coinsurance is nothing for the first 60 days after you meet your first day deductible, and then some cost per day depending on how many days you're in the hospital. Medicare Part B is your medical insurance. Your premium is dependent upon your income. The standard amount in 2024 is $174. The deductible is $240 in 2024. And your coinsurance after the deductible is 20% of the Medicare approved amount. Part D is the prescription drug coverage. For once, they made it relatively simple. D is for drugs. The premium depends on your income, and the deductible is between $0 and $545 for the year 2024, depending on the drug plan. Your copayment or coinsurance amount depends on the drug, tier, and the level. These plans are administered by private companies. To throw some more definitions at you, the Extra Help or Part D low-income subsidy is a program that helps cover out-of-pocket costs of Medicare prescription drug coverage. Dually eligible beneficiaries are if you are enrolled in both Medicare and TennCare. Partial benefit dually eligible beneficiaries receive benefits through an MSP, but they do not receive full TennCare benefits. Full benefit dually eligible beneficiaries qualify for full TennCare benefits through other pathways and can still receive assistance through the MSP. There are some dates to be aware of when we talk about Medicare. The Part A and B enrollment period is 3 months before your 65th birthday, 3 months after your 65th birthday, and the month of your 65th birthday. So it's essentially a 7-month window with your birth month in the middle. It is also the 3 months before or after the 25th month of disability benefits receipt. Again, it also includes the middle month of the 25th month in which you receive the benefits. This is for your people who've been on disability. They don't receive eligibility as soon as they go on. They have to be on for 25 months before they hit that 7-month window. There are exceptions to the enrollment period if you have ALS or end-stage renal disease. This is kidney failure. For people who fall into those categories, their enrollment period is as soon as they're identified as eligible within those categories. There's an additional enrollment period for Part B. If you, at the time you became eligible for Part A, decided not to get Part B coverage, or at some point decided to drop your Part B coverage, you can enroll in Part B again if you previously opted out, only in the months of January, February, and March of each year. So if you currently are a Part A enrollee and you want to add Part B, you need to make sure that you do that before March of this year. Now we're going to look at some program types. I hope if you're watching this that you enjoy acronyms, because I'm going to throw a million of them at you. I promise I'm not responsible for making them up. We just have to live with them. The first is the Qualified Medicare Beneficiary, or QMB. This category covers costs for Part A and Part B premiums, deductibles, coinsurance, and copayments. The monthly income limits for 2024 for an individual are $1,255. For married couples, it's $1,663. Your resource limits, or what you can own, for an individual, it's $9,430. And for a married couple, it's $14,130. Now you'll see to the side here the note on resources. The states count your checking, savings, retirement, stocks, and bonds. They don't count your home that you live in, one car, or up to $1,500 for burial expenses or the value of your furniture. QMB enrollees won't be billed by providers for Medicare covered services or items. If you're in the QMB program and you do receive a bill, you need to contact your provider and inform them of your status in the QMB program. If you already paid a bill, you can contact TennCare and they can assist you in getting a refund for that bill. You also get extra help paying for your prescriptions. In 2024, you won't pay more than $4.50 per generic drug that's covered by the Medicare drug plan, or $11.20 per name brand drug covered by the Medicare drug plan. The next category is Specified Low-Income Medicare Beneficiary. You may also hear it referred to as SLMB or SLMB. It helps pay for Part B premiums. The monthly income limits are $1,506 for an individual, $2,044 for a married couple, and your income must be over 100%, but less than 120% of poverty. The resource limits for an individual are $9,430, and for married couples, 14,130. To be in the SLMB category, you must have Medicare Part A and Part B, and you'll get extra help paying for your prescriptions. Again, you won't pay more than $11.20 per drug covered under your Medicaid drug plan. The next category is qualified individual. Here at TJC, we call that QI. You will go to the TennCare website, you'll see it referred to as QI1. There used to be a QI2, there's not anymore, so we use the term QI, but they still use the term QI1. This category helps pay for your Part B premiums. The monthly income limits are $1,661 for an individual, $2,239 for a married couple. And those income limits are based on an income, that must be at least 120% of poverty, but less than 135% of poverty. You'll note when we're going through these categories, there are some that have both an income threshold and an income limit. So you have to be above a percentage and below a percentage. Your resource limits for an individual are 9,430, and again, for a married couple, 14,130. For a QI, you are not eligible for this plan if you qualify for TennCare. You will get extra help paying for your prescriptions. Again, it's 2024. I believe I have a typo there. $11.30 per drug covered under your TennCare drug plan. And you must reapply each year. It's on a first come, first served basis with priority given to those who received QI benefits the previous year. So if you have QI, you want to make sure and note on your calendar that you have to reapply each year. The next category is one we don't see very often, but it's called Qualified, Disabled, and Working Individual, or QDWI. You may qualify for QDWI if you're under 65, working, have a disability, and you lost benefits when you returned to work. So you lost your Social Security disability and Medicare premium-free Part A when you returned to work. And you lost this because you're engaged in substantial gainful activity. The QDWI program pays for Part A premiums only. It has a resource limit of $4,000 for an individual or $6,000 for a couple. The QDWI income counting is a little bit more complicated than other categories. You must have countable income below 200% of poverty after disregards and adjustments. The application process. When you're applying in Tennessee, you have to fill out a TennCare application. You can do this with a paper application that you can download from the website on the slide. You can do it online at tenncareconnect.tn.gov, or you can do it over the phone. For the prescription drug plan, you can fill that out with the SSA, and they will automatically share your information with the state TennCare office unless you opt out. If you're going to submit your application on paper, we recommend you make a copy before submitting, save the proof that you submitted, and you should receive a notice of action within 45 days of submitting your application. If you don't receive that, then you need to contact TennCare. MSP recipients need to know that you will go through a renewal process. The effective dates for your enrollment are for QI, SLMB, and QDWI. Your eligibility begins on the date of your application filing, or when all eligibility requirements are met, whichever is later. For QMB, your eligibility begins on the first day of the month after your application is approved. When you go to get care, you need to show your Medicare card and your QMB card. Now, due to the COVID emergency, Congress was required to keep Tennessee enrollees covered during COVID. So redeterminations were not happening. Redeterminations have started again. This is your renewal process. And that began on April 1st, 2023. So TennCare is reviewing all Tennessee enrollees to see if they are eligible. This may require you to fill out a packet of questions, which is your renewal packet. If you'd like more information about the renewal process, we have a series of trainings on the unwinding and how to navigate it. That's on our training hub and posted on YouTube. We also host monthly office hours to answer questions and learn from you. If you'd like to join the office hours, you could contact Shana Watkins at swatkins@tnjustice.org. The next meeting for our office hours is going to be on February 20th, 2024, and we will be focusing on the experience that people are having with their MSPs. Now, when you get prepared for unwinding, you need to know, which is, again, this re-enrollment process. If you're not eligible for TennCare or your MSP, you may be terminated. If TennCare does not think you're eligible, you should receive what's called a preterm notification form that you should fill out and send back. If you're not eligible, you also should receive information on how to appeal. Whether or not you're eligible, you need to make sure that your contact information is up to date with TennCare, because these notices are going to come to the address on record with TennCare. So you want to make sure that you are checking and updating your contact information so that you will be sure to receive your notices. TennCare has a new app that's the TennCare Connect app. You can download it from the App Store. You cannot submit new applications through the TennCare app, but you can report changes. You can review your letters, and you can upload and send documents. You can also sign up for alerts in the app, which will make sure that if one of your renewal notices is lost in the mail or you have a request for additional documents, it will send you an alert through the TennCare Connect app. If you use the TennCareConnect.gov website, you can go into your, what they call the portal, which is how you sign into the your TennCare Connect app on the web-based version. And you'll see there's a section on there where you can report a change. That's where you're going to want to update your address. You can also do your renewals through there, and you can upload documents that they're requesting. If you log into TennCare Connect for the first time and you don't see your coverage information, what you see on the top right of my screen is this link that says link my case. That's where you can input your date of birth and social security information, and it will upload it will connect the information on your TennCare account to TennCare Connect. This will allow you to see your current coverage, any notices, any letters, and allow you to submit documents. I've been using the TennCare Connect app on behalf of some of my clients. I will say that if you don't have access to a scanner or a fax machine, but you do have a smartphone with a camera, the TennCare Connect app is probably the easiest way to send documents to TennCare, because you can take a photo on your phone and then upload it right through the app, and it will send it to TennCare. So you're not having to send things through the mail or through a fax. And I find it easier to upload documents through the app than I do through the desktop version. There are some alternative programs to be aware of. There's Medicare Advantage plans, which you'll know as the Medicare Part C. These provide all of the Part A and Part B benefits, but this is through a private company. They may also include drug coverage. Medicare Supplement plans, which is also known as Medigap, helps pay for co-payments, co-insurance, and deductibles. Again, you're paying a monthly premium for that to a private insurance company. If you need assistance applying for a Medicare Savings Plan, we have linked our information here, the Tennessee Justice Center, and our phone number. You can also get help through TennCare Connect. We've got their online address listed here, and their phone number, or through the state health insurance assistance program, or through Social Security. Our bonus slide has some links that you may want to reference for the accountable resources for MSP. There's overviews from the Centers for Medicare and Medicaid Services. There's information on Social Security SSI resource counting. There's information on the Rural Health Association of Tennessee for help with renewals. The Tennessee PACE program. If you're in Hamilton County, you should know that there is one program that is only for Hamilton County, and we've got more information via a link there. And if you want to look at data about unwinding, if you're just into public health, you can submit a records request with TennCare on the link below. If you have additional questions, you can always reach TJC through our Facebook, Instagram, and Twitter accounts. We have a lot of informative videos on YouTube and additional trainings. So I'm going to go up to our Q&A now. Let's see. First question from Jeffrey. If a person has Medicare and QMB, does this person have comparable equivalent coverage as a person just on TennCare?
Basically, yes. The only thing that they don't get if they're not on TennCare are transportation costs covered by TennCare. And their TennCare does not require you to have skilled care to get home health services, and Medicare does.
Okay. That's the ever helpful Jane, the angel on my shoulder. The next question from Steve is, do even eligible non-citizens have to have a social security number? I don't believe they do, but they do. To be an eligible non-citizen, you have to prove that you have certain statuses as a refugee under certain categories. So you have to provide certain identifiable information to qualify under those non-citizen statuses.
Yeah.
And okay, and Jane's telling me you must also have to have proof of application for a social security number. Okay, this is a good one, Jane. From Jeffrey, had a client hit with a penalty for delayed enrollment in Medicare. What's that about? So that's going to be someone who, when they were eligible for Medicare, they elected to opt out of Part B coverage. That normally happens because they have coverage through an employer. And then when you lose that employer coverage and go to enroll in Part B, there's a penalty for having not enrolled in Part B when you first became eligible.
Except if you are on an employer plan, that's an exception. Okay, because you opted not while you were covered by that employer plan. If you just opted out and you did not have an employer plan, then there is a penalty. Not only that, I think we had a slide that's not only that, but you can only apply in January, February, or March of the year. And then your coverage starts the month after you apply, but you do have a penalty. However, if that person is eligible for a Medicare Savings Program, the penalty will be waived.
The next question from Andrea. My son is in ECF Choices. He has a Medicare Advantage dual coordination special needs plan with AmeriGroup. He also has QMB. Providers do not know how to file a dual coordination plan. How can I help providers understand how to file these plans? I frequently receive bills from providers, even though it clearly states on the insurance card that there is no cost or copay. He has also been denied seeing a provider until I paid something while checking in, which I have done. So that would be one where you've received where he's on QMB, but you're receiving a bill. That you're going to have to contact TennCare. You would inform the provider that you're not supposed to be billed because they're on QMB. And I would recommend that if it's a matter of you need to get the care that day and you can pay the amount they're wrongfully requesting you pay, that then you contact TennCare about reimbursement for that fee. But they should understand that on QMB, you're not supposed to be charged.
If you're on traditional Medicare, usually what happens is the provider sends the claim to Medicare. Medicare automatically sends that claim into the state. I'm not, a special needs plan, I think, is a Medicare Advantage plan, and that may be the issue. And you are seeing a Medicare they are seeing a Medicare provider, I presume.
Well, she can't answer, but let's see, there's 2 questions in the other chat. Let me go to that. I'm gonna stop sharing my screen. Let's see the Q.
I should add that the Center for Medicare and Medicaid are very concerned about providers billing people who are on QMB.
Are these slides on your website? The slides will be sent to you after the presentation. And then the next question is, do you deduct the disregard from these amounts? Oh, of the income on the slides. No, if you go by TennCare's slides, yes. If you go by our slides, we already have the disregard factored in.
And TennCare's income limit doesn't, let's see, how to put this. They don't even mention the earned income disregards for MSPs.
Yeah, so it can be quite confusing. If you are in that window where that $20 makes the difference in whether or not you qualify, please feel free to reach out to TJC and just run the numbers by us and say, I want to make sure that I'm looking at this right. And do you believe that I would be eligible based on these income numbers? Okay, I think we have all of our questions answered.
Could we talk about the fact that TennCare is disenrolling MSPs for March?
Yes. So Jane has brought up one other issue that we're seeing come up, which is for people who have an MSP, that you are not supposed to be disenrolled between now and March based on being over income, because the federal poverty limit will be adjusted April 1. Is that right?
Usually.
Yes. So if you're on an MSP and you're being disenrolled due to being over income, please reach out to us for assistance with that as well. If you have other questions, you can always reach out to TJC. We're happy to talk about your eligibility and help you look at what plans you might qualify for. There's a lot of good information on our website, a lot of webinars from past presentations that you can access, and links to other service providers that may be able to assist you. Hope you enjoyed this presentation and it was informative, and thank you for joining us.